Dental implant dentist, do you want to see the exact steps and processes we've used to generate over $1 million in new patient revenue in the last 12 months for Dr. Siona? Check it out. Step 1, your offer. Now, what we know to work best for implant patients is a free consult, exam, 3D scans, plus $1,000 off. That's a pretty standard offer. You can even adjust the dollar amount off or completely remove it depending on your market. Now, don't be afraid to offer free or a dollar amount off on the front end. Based on our studies and practice data, free offers outperform paid offers every time. Plus, you can always adjust your pricing or terms to revolve around this offer. Step 2, your follow-up process. Make sure to follow up with leads. I know that sounds pretty common sense, but you would be surprised at how many practices miss this extremely important step. Either they take too long to follow up, they don't follow up enough times, or they don't follow up at all. This means you're wasting money. Now, if your ads aren't working or aren't performing, it's most likely either your offer or your follow-up process. Now, we make the follow-up process and getting in touch with patients super easy by initiating the first point of contact and by allowing patients to request a callback time from the practice. So that's all tracked within our client dashboard. It literally takes your staff just a few seconds to handle per new patient, not including the actual conversation time. Now, this way, we're not overwhelming the staff with a spreadsheet full of leads where they have to make a ton of phone calls every day, waiting on potential patients to answer the phone. That's the old way, and frankly, it just doesn't work, and it's a waste of time and resources. Our new way minimizes staff time while also increasing your new patient appointments and contact rate. Step 3, build a relationship on the first phone call. Make sure your staff is trained to communicate effectively. Get to know why the patient is searching for treatment. Get them excited about the practice. Get them excited about how treatment can be life-changing for them. Then get them scheduled. Easier said than done sometimes, I know, but as a bonus, we do provide our practices with ongoing training and coaching and an easy to follow up phone script to make sure this step is a piece of cake. Here's a tip. When dealing with cold leads from paid ads, they will take more work to get in the door versus a referral. So to reduce no-shows, we do recommend you take a credit card on file to hold that appointment time. Step 4, get them started on treatment. On their first visit, let's make it great and welcoming experience for them from the second they walk in the door until they leave. And when it comes to treatment presentation, remember, you're talking to an ordinary person that usually doesn't have experience with dental terms. So let's simplify it down a bit. Let's focus on the benefits rather than the process and the technical terms. That just gets confusing and it makes treatment acceptance more difficult. Believe in what you're doing and how it can impact and change your patients' lives. This will come through in your tonality and presentation, and it will reflect back to the patient who wants to be able to trust you. Now, whether we like it or not, we're all in sales at the end of the day. That does not mean we have to be that typical used car salesman, though. It does mean that implementing some simple techniques will result in a higher treatment acceptance rate. Now, here's another tip. For higher treatment value cases, let's have multiple financing options in place. These options and pre-checks can even be done and discussed before treatment presentation so that you and the patient both have an idea of what they can potentially afford. Do not, please do not send them home with a link to an online application. Most of the time, they won't take the time to fill it out. Walk them through the application process in office, face-to-face, so that you can answer any questions and so that you know it gets done. Most financing companies will allow pre-applications with no effective credit score, so this should be a pretty easy process. So there you have it, 4 basic steps of our patient engaged system that's responsible for millions of dollars in new patient revenue. Let us know how we can help your practice.